Hello, my name is Doug Bernard. I'm the Chief Medical Officer for White River Health System, and I've been in this current role full-time since 2015, and prior to that I've been in practice in Batesville with a generalized family medicine practice. My current role at the hospital, in addition to being the Chief Medical Officer, is I oversee essentially the evidence-based care that we provide for our patients. I'm also medical director of our inpatient rehab unit as well. And very proud of our hospital. We've been going through, as everybody out there has been, this COVID crisis, and we were very fortunate to get on top of this early. I think our health system, all of our partners, our employees have done an outstanding job of not only protecting our patients, but protecting themselves and also protecting our communities. Recently, we have been started elective procedures, limited elective procedures for certain groups of people, and these guidelines were given to us by the Arkansas Department of Health. If you are somebody that has an elective procedure planned, what would happen is we would ask you to come in at least 2 days before, preferably 1 day before, to have a COVID test, which we will be able to give those results to your surgeon. If the test was negative, we would have you come in on the morning of surgery. You would still be temperature checked. We'd ask you to wear a mask when you come in, and you would keep that mask on throughout your stay in the hospital, other than when you were having the surgery done. So you will be screened both for when you come in for a COVID test, and you will temperature screen then, and you'll also be temperature screened with a mask when you come back in on that day of surgery. And then our goal is to make sure that any of these surgeries that we do, the patient is going to go home on the same day. That is a directive from the health department. We don't expect any complications from surgery, so we try to keep the surgery limited to something that we can ensure that you're going to go home the same day. So when the COVID crisis or the COVID pandemic started, we were very proactive. We isolated a 16-bed unit in our hospital, which I'm sure you've heard this on the news, but if you haven't, it's a negative pressure environment where the entire unit is negative pressure, where germs and are filtered out of that area of the hospital. We have, in addition to that, inside that 16-bed unit, isolated some areas where if we do have a COVID positive patient, we can keep those people isolated from the patients that are admitted while we're waiting on their tests. So we have been set up and staffed to take care of those patients as needed. So again, when the pandemic began, we began screening people when they do come to the clinic. So if I'm going to go see my family doctor, they're going to ask me to bring a mask, and then they're going to check my temperature when I come to the office before I even get past the waiting room. And they're also going to ask me if I'm having any symptoms such as headache, malaise, fever of any type, a cough, body aches. And so if I have any of those symptoms, now we have a different problem. But if you don't have any of those symptoms, they're still going to check your temperature, ask you to wear a mask, and probably ask you to bring a mask when they confirm your appointment, and keep that mask on the entire time you're at the appointment. Well, as we're starting to see our society begin to slowly open up, and I do want to encourage everybody we need to take this slowly, because I do feel like this virus is going to be around for some time, and that doesn't mean we can't deal with it. I think we're dealing with it as well as can be expected. Many people still have chronic medical problems. We don't want you to avoid going to the doctor or avoid using our telemedicine service, but there are times when you have to see your physician, and we don't want you to not go to the physician, because again, we have processes in place to not only protect you but protect our staff. Same thing with the emergency room. We've seen some of our emergency room volumes drop, and I understand that. We're starting to see them pick back up a bit. So if you're having symptoms where you need to see a physician, if you can't make it to the office, we are open for business at the hospital. We will see you in the emergency room just like we always have, and I don't want anybody to delay a medical problem because of concerns for COVID. It's just that simple. We are prepared to take care of you, and we are open for business 24 hours a day, 365 days a year.